Good morning, ladies and gentlemen. Being diagnosed with cancer is not a death sentence. My name is Anthony from HCG Cancer Centre, and today we are privileged to be in Migori County, Rongo Sub-County, Rakwaro Village, to have a story of one of our cancer survivors, Mr. Charles Angila, who is a teacher by profession and who has emerged as a cancer winner. Welcome, this is his story.
My name is Charles Angila Owor. I am a teacher by profession. I taught for 36 years and retired, and I'm resting at home right now. My family members, I have one wife, Mrs. Hilda Angila.
My name is Hilda Angila. I'm my wife to Mr. Charles Angila Owor.
I have 4 children, 3 boys and 1 girl. I started to become sick last year, 2024, around June, when I felt I could not release my urine in the normal way. I had some difficulties. So I had to tell my family members that I was sick, and they advised me to go to the hospital. The first hospital that I attended was Vena, Rakwaro Mission Hospital, where I was done some tests, and they advised me to move to the next level. So I went to Parklands Hospital, Migori, where they did the same tests. They forwarded them to Kisumu, the hospital in Kisumu, and I got the results. Hospital in Kisii, we consulted Dr. Raymond Oigara, who is a urologist, and he made the tests and found that I had some problems in my bladder. There was a growth tumor that was blocking the urine not to come out in the normal way.
Okay, if I can talk about my husband's sickness, sometimes I was down. Mr. Angila, as my husband, is a very strong man. Sometimes you cannot know that he is sick. We had stayed for a long time with him, but I've never seen him down, and you can't know that he is sick. Last year, when the sickness started, he was ever quiet, but I realized that something was going on, something wrong was going on.
And that was the problem I had. So Dr. Pondo wanted to do surgery in Synergy, Kisumu, but the cost of the surgery was high. He told me he wanted 300,000 for the surgery. And at that time, there was a challenge in SHA. The SHA was not taking any amount from the private hospitals. So I came back and I consulted with my family members. And because our first girl is a nurse at Kenyatta National Hospital, we consulted with her and said, Dad, let us find a doctor in Kenyatta so that you can come and we do the test and then you are treated here. Because that money, there's nowhere we are going to get it. So the problem of money made us to be referred from Kisumu Synergy to Kenyatta National Hospital. I managed to see Dr. Icol that my daughter had talked to. So I was admitted in Kenyatta after a very short time. We followed the tests, and the tests were done, and it was found the same, that I had that tumor growth in my bladder. So the first operation was done on 1st November 2024 in Kenyatta National Hospital, after which I was relieved. The urine which was not coming out now was coming out in a normal way. I came back home and I stayed for some time. And when I went back, they said I delayed and did not do the right thing that they told me I was. There was some confusion during that time. And then when I went back, they told me the growth was coming up again. So I had to be done the second surgery. And the second surgery was done on 16th April 2025 in Kenyatta National Hospital. After that, the doctor I called told me that now when we have done this, we want to move to the next level. The next level was to take me to the Cancer Treatment Centre in Kenyatta, which we booked, and we went. When we went, we did everything possible to start the treatment of radiotherapy and chemo in Kenyatta National Hospital. But the snag was that the machine for radiotherapy was not working. So the doctor had to refer us to HCG CCK, where we brought the referral letter, and we did everything that was required so that we could be treated at HCG CCK. Dr. Ching sent us to George, the social worker, and we met him at the reception desk, and he treated us so well. He took our details, and he told us we had to do some tests. CT scan had to be done again to check the organs. That was done, and we paid money. We were told for CT scans to be done, we had to pay 20,000, but they gave us allowance of SHA taking 6,900, and 13,100 we had to pay cash, so that they could do CT scan tests. We did that on that day, and we went for the CT scan, which was done, and we were told to wait for a week so that the result could be gotten, so that the treatment could be started. We waited, but before the week ends, we got information that the result was out, and we went. Dr. Cheng negotiated my starting treatment the following week, and on 7th May, I was treated for the first time in the machine radiotherapy. Second day, 8th, I was treated. But after that, on 9th, the third day, I got another accident, which took part of my time. I went to Mama Lucy Hospital. My tendon was cut off when I was taking birth, and was admitted at Mama Lucy Hospital for 3 days. And my daughter and our cousin, Lamek, called the CEO, Mama Lucy, to tell him that I was being treated at HCG CCK, doing radiotherapy, and I could not miss twice. So they had to discharge me on Monday to attend the normal session that had started. So I attended. Dr. Ching came after that time and saw my condition and negotiated with the social workers so that my time of reporting for session had to be changed. I was supposed to be attended at 5:45 in the evening PM, but that was not very possible with the condition I was in, and they had to give me another time I would report now at 10 a.m. so that I could find time to go back home. I want to say that the treatment that I started because of my family. They supported me, especially my wife. And she advised me on what to do. Even during the surgery, she was there with me, stood with me for the 2 surgeries that I had in Kenyatta. I was very happy.
So I just want to tell you, other people who are having patients, like me, my husband, I'm a caretaker. We should be very strong. Love is first. We should love them very much. And we care, and we give them food, and we let them just feel like other people. With me right now, I'm very strong. When I see him, he's stronger than me even now.
She was there for me and provided what was required. To my children, I want to say they have supported me, like my daughter in Kenyatta has taken everything in her hand. And the boy, my last born, who is also working in Nairobi, I was residing with him. He did the work that was supposed to be done. At HCG CCK, I want to say the workers are wonderful. They are loving. When I went to the reception desk and explained, they took my issue very well. HCG CCK, I want to appreciate you as an institution because you have brought the treatment closer to the people. People used to go to India for the treatment of cancer, but it is now within Kenya, within your institution, where so many people get help.
So my name is Dr. Primus Ochieng. I'm a clinical oncologist and I practice here at HCG Cancer Centre. And I also practice at Kenyatta National Hospital, where I'm also in charge of the training program for oncologists in the country. And I'm glad today to talk about Mr. Charles, a patient whom we walked the journey with. So Mr. Charles was a patient who came from Nyanza, and I met him at Kenyatta National Hospital when he came for treatment for bladder cancer. And at that time, he had a lot of complication from the cancer. He had bleeding. When he passed urine, he had problems with pain in the lower abdomen, and he was quite anxious about his sickness. As always, cancer is a very emotive disease. But the anxiety became worse and he became very confused when we met him in early May, and the machine in Kenyatta had broken down, and also the kind of machine that we had at that time was a 2D treatment, and that treatment would have been inappropriate for his cancer treatment. It would have been inappropriate in that it would still give us the good dose that we need, but it would cause unwanted side effect to really cause trouble with her bowel, and that could lead to a lot of diarrhea during treatment. It could go and affect his hip joint and can break his bones later, many years after treatment. It could also irritate his very bladder that we are treating and make him have more complications. It would also harden his skin, and then would get lots of trouble. And so because of that, we actually had to look for an alternative of the treatment. So we informed him that it wouldn't be possible for us to offer him the kind of treatment he required for his bladder cancer at Kenyatta National Hospital, which would involve chemotherapy and radiotherapy at Kenyatta. The next thing then we told him, you have to take you to a private sector where you can be given treatment. He was extremely worried because he informed me that he had retired and he would solely rely on the SHA to meet his medical bills. And so taking out of Kenyatta, he felt he wouldn't be able to afford the treatment at all, because topping up or additional fee out of SHA, he wouldn't get that money. He also informed me that he has sons who are working but are still not stable in their employment, and probably they may not be able to assist him with the top up. And that's why he was quite anxious. So we took him through, and I consulted people at HCG Cancer Centre, and they were gladly willing to assist him. Not only they were gladly willing to assist him, they were actually ready through Faraja program be able to give him SHA treatment, a small top up, and if there's any other treatment which he needed on top of that, Faraja would assist. And so that's where the journey started. So we sent him to HCG here, and he was well received. He called me back that he was very, very excited. He couldn't believe it that private hospital could actually take care of him, even if he can't be able to meet all the cost of his treatment. So we started the journey. Unfortunately, during the treatment, he fell down at where he was staying at his son's place, and then he fractured his knee. So we had to stop the treatment for about a week or so just to sort out that. But he told me that the pain didn't mean much to him, because his biggest problem and his fear was that his cancer, if not treated, can consume him more than the injury. So he sojourned on, and after the treatment of his knee was put on a cast, he then started his treatment and continued. So he went through the treatment. He went through a 3D and a bit of VMAT treatment, which he tolerated very well. He was a very motivated patient. He had very minimal side effect, I would say grade 1 to grade 2. Apart from just the injury, we didn't disrupt his treatment through and through the treatment. He would tell me he loved the hospital, he loved the people, he loved the facility, and he loved everything. He was impressed with the way the hospital was organized. The staffs were very friendly. There were many patients that would come, and he would say that he will still get treated. But what excited him more is the fact that there was support group where he could share with other people, and he could also share his problem with other people. And so despite the two problems that he has, the cancer and the injury, the treatment to him went very smoothly, and he actually appreciated the work. So what I'm appealing to many patients, you need to come to an hospital for treatment of cancer where you get actually psychological, emotional support. Cancer come with a lot of emotion. It's not just the physical treatment that a patient needs, but you also need this emotional support. You also need a very friendly environment. And we encourage the cancer patients also to talk about their problem very easily, so that they can go through smooth treatment. It has been known and has been actually documented that patients who enjoy their treatment, have good relationship with the facility there they get treatment, good relationship with the doctors that treat them, they tend to do much better. Their cancer get good control, and the recurrence are much less than those patients who tend to struggle a lot with the facility. They don't like the people who treat them. They don't even like where they're being treated. So HCG is a very comfortable environment. Please come and we'll take care of you.
Just from what you've heard from the testimony from Mr. Charles, we believe that cancer is just a disease like any other, and it is treatable. So we just want to assure you that with the right support system, care, management, and treatment, It is locally available at HCG Cancer Centre in Nairobi. And we just want to say that there is no need of anyone suffering from this scourge to go overseas looking for the same treatment that are locally available. So we just want to say thank you very much for Mr. Charles, the family, the relatives, who gave us the warm reception here in Migori County to attest to the public that cancer is a disease like any other, and he has emerged a winner. Thank you.